FDA is authorizing an experimental drug for emergency use in coronavirus patients. The drug Remdesivir has been getting a lot of attention after a preliminary trial found it helped patients recover more quickly. And now, a new study in Washington state is showing such positive results, they're no longer even using the placebo. Here's Sarah Seidner.
It was now everybody that was potentially at risk.
Dr. Francis Rito is an infectious disease specialist on the front line of the war on coronavirus. From the first confirmed COVID-19 death in the U.S., Rito and Evergreen Health in Kirkland, Washington, are now at the forefront of finding a treatment. They're taking part in a clinical trial of Remdesivir.
This is an intravenous medication that's given for 10 days.
After it was administered to the sickest COVID-19 patients, Dr. Rito says it showed real promise. And that was just phase 1 of the trial.
When you go into a second phase of the trial, what does that mean?
So the second phase is going to use this as the backbone. So every patient will receive Remdesivir because the first trial, Act 1, showed benefit, shortened the course of illness, and almost statistically significantly showed a decrease in mortality.
In phase 2, some patients will also get a companion drug called baricitinib, which is used to treat rheumatoid arthritis. But every COVID-19 patient in the trial will now be treated with Remdesivir.
Why is that a big deal?
That's huge. This is the first scientifically proven beneficial drug in terms of the treatment of SARS-CoV-2.
Trials of the drug are happening across 68 sites. More than 1,000 people have taken part. The result? Patients recovered 31% more quickly with Remdesivir. That translates to 4 fewer days of suffering in the hospital.
Although a 31% improvement doesn't seem like a knockout 100%, it is a very important proof of concept, because what it is proven is that a drug can block this virus.
Remdesivir was originally created as a potential drug to treat Ebola. Dr. Rito was also on the front lines of that battle, traveling to Africa. He hopes the drug works this time around. But before this second trial was done, the president, alongside the CEO of Gilead, who makes the drug, announced the FDA's emergency use authorization for Remdesivir.
We'll be working with the government to determine how best to distribute that within the United States.
The FDA acting unusually quickly. For now, the drug is being used only in hospitals on the sickest COVID-19 patients. It is not a cure. Some of the patients treated with the drug still died, but others felt better faster.
So this could be one major tool in the fight against coronavirus.
Correct.
Wow.
But it all has to be proven. We all have to do the science, the careful science.
I want to bring in the former acting director of the CDC, Dr. Richard Besser, and physician and public health specialist, Dr. Saju Matthew. Dr. Besser, I want to start with you because you actually traveled to Africa during the Ebola outbreak, and Remdesivir was originally created for Ebola, but it didn't work. Why does it seem to have an impact then on COVID-19?
Yeah, I mean, it's a good question. When viral drugs are developed, or any drugs for infectious diseases, it turns out they work against some organisms and not others. What it appears that Remdesivir does is it interferes with how the virus multiplies. Viruses take over our cells and they multiply and then they spread through the body. And this drug interferes with its ability to do that in a way that gives hope that there could be treatments that significantly improve the outcome for sick patients with COVID-19.
Dr. Matthew, Dr. Fauci expressed great optimism as he was reporting that in a clinical trial, Remdesivir sped up recovery by 31%. The group that took Remdesivir recovered in 11 days versus 15 days for the placebo group. How significant is this?
Very significant. Good evening, Anna. You know, I was just talking to an ICU friend of mine who treats COVID-19 patients right before I got on air. For anyone that's been in the ICU, and I've been in the ICU multiple times when I was a resident, we're talking about the sickest patients in the ICU. So for any day or hour that you're spending less in a hospital setting or in the ICU setting is huge. A lot of our COVID-19 patients, Anna, they're intubated. The ramifications of being on a tube long-term are huge. Vocal cord paralysis, decreased swallowing. If you're in the ICU, you can die of ARDS, acute respiratory distress syndrome, septic shock, multiple infections called nosocomial infections. 1 day less in the ICU is huge. 4 days less is very significant.
Dr. Besser, what about possible side effects? Because as we recall, that was a big issue when it came to hydroxychloroquine.
Yeah, I think that's a really important question. You know, although this was a decent-sized study with 1,000 patients, half of them getting remdesivir, that's not enough to really be able to see whether there could be some safety concerns. So as this drug goes forward through the emergency use authorization, that's something they'll be looking at, as well as looking to see whether the drug has potential for patients who aren't quite as sick as the patients in this study. A real challenge is going to be scaling up production since there aren't any other drugs at this time that have been shown to have value in treating patients.
Dr. Matthew, Dr. Besser just touched on this, but we know that once this is approved, it is only going to be given to the sickest of patients, and we do know it was approved for emergency use just last night. But is there reason to believe this could help prevent people with mild symptoms from developing more severe symptoms like Tamiflu does for the flu?
Good question, Anna. Tamiflu is a medication that I use all the time as a primary care physician. The convenience of Tamiflu is that you can give it as a pill, and you can give it to patients as soon as you suspect that they have flu-like symptoms. With Remdesivir, it is an intravenous drug, and as Dr. Besser mentioned, yeah, this has to be given in a hospital setting, and there are side effects to the medication, like increased liver enzymes, decreased blood pressure. So can this medication at some point be given to patients who are recovering at home, like Tamiflu? It possibly can. You can alter, if you will, the molecular structure of Remdesivir and actually convert it into a pill form. So I think that down the road, once we start seeing better data from Remdesivir, that perhaps we could have a pill-like form of Remdesivir that we could give patients who are recovering at home with mild symptoms.
Let's pivot, because this week, former director of the CDC, Dr. Thomas Frieden, said we are over the worst phase of this pandemic. But then he also said this.
The pandemic is bad, and what we have to come to terms with is that it's just beginning. This is on the order of the 1918-1919 influenza pandemic. That's how bad it is. It is the worst health threat in 100 years.
We know the Spanish flu had a second wave that ended up being deadlier than the first. Dr. Besser, how can we both be past the worst stage and also have this be as bad as the Spanish flu?
Yeah, you know, I think what Dr. Frieden is pointing out is that we can't be complacent. We don't know the cycles that this virus is going to have as it continues to go through communities and around the globe. With the Spanish flu, when it came back in a second wave, it had mutated. There were changes in terms of how people were interacting. So, you know, as the economy opens up and people are doing more, if the virus comes back, if it's at the same time as influenza, we could have a bad wave, and we have to be ready for that. We have to be paying close attention, and that brings us back to what we've all been talking about for weeks: the need to be able to do testing, to do data, to be able to look at populations, not just overall, but the populations that are getting hit the hardest, Black Americans, Latinos. We can't take our eye off these challenges. And especially, you know, I just want to raise one more issue about Remdesivir. It's going to be in short supply when it first comes out, and we need to make sure that it gets to all patients in a fair way, not just those who are higher income in certain areas.
A good point there. Dr. Richard Besser, Dr. Saju Matthew, I really appreciate both of you being here with us. Thank you.